I'm with my good friend and colleague, sat next to him for 4 years in that fellow's room,
It
Dr.
was
Harlan
amazing we did that.
Krumholz. And, Harlan, so proud of you. Congratulations. Jack is lucky. Talk to us a little bit about your vision. What do you want to do with the journal?
Yeah, well, first let me just say I am thrilled. It's so wonderful to have this opportunity and great responsibility. In the outpouring of support, the kind of notes I've received, anyone who's listening who's somehow reached out to me, I just want to say how much I've appreciated that and will work hard to be worthy of this position and to make it really great. And with regard to the vision, I mean, I think it's simply this, like these journals, they have a possibility of being a force for good. We live in a society where there's a lot of misinformation. We have issues around evidence. These journals, they can help produce the kind of information, work with authors in a collaborative way to ensure that we're disseminating very strong evidence that helps guide decision making in ways that are most useful. So look, I want JACC to be the most author-centric journal out there. We don't, suspect that authors are trying to get away with stuff. We know that they're just trying to help publish good science and get things out there. And we want to be able to work with them, sifting through, the submissions and finding those that are meritorious, and then working hard with the authors to ensure that the communication's clear and easily understandable. We want to be inclusive. That means that we want to look all around the world and in all types of different types of science and researchers to be able to make sure that people feel very welcome, and at every level of the journal with regard to review or how we improve. We want to be able to be listening for suggestions, and we want to be of the community so that people feel that they're really part of this. We're deeply committed to the international side. We consider ourselves a global journal. So it's not just, we're anchored in the United States, of course, but we want to be able to say that we're recognizing how do we lift cardiovascular health and fight cardiovascular disease wherever it exists throughout the world. And we do so in a way that respects and honors the kind of work that people and the challenges that people face in all sorts of different places. And then, I'm an outcomes guy, so I'm interested in impact. Can this journal be an instrument of improving patient outcomes? Can we do this in a way such that what we produce, which is helping authors, who are submitting content to be able to disseminate great science, perspectives, information that's useful to people, can we help translate that in ways that actually at the end of the day that we feel that we've elevated patient outcomes? And then I want to say that we're building on a tradition of excellence, starting with Simon Dack, Parmalee, Demaria, and most recently, an extraordinary physician scientist, Valentin Fuster, who's been, leading this for the last 10 years. So I'm humbled by that tradition and eager to see whether or not, we can build on that excellence and even take this journal to the next level in the next era. And we're facing a lot of issues, that in healthcare these days, so that, it's important for these journals to be a really important a point in this storm in a way, that a place where people can come and we can work hard to ensure the future is better than the past.
Well, I've been a big fan of your efforts with preprint servers. How can you integrate that in to make it a positive thing to really, help advance the field?
Well, look, I'm deeply committed to preprint servers. As you know, I was co-founder of medRxiv. And the idea is that while the journals are taking on a deliberative evaluation of certain papers, that authors can post them immediately so they can go out for public comment while they're undergoing peer review. And that it accelerates the ways in which scientists can communicate with other scientists, that we can begin to disseminate information more rapidly, but in a preliminary form so people understand this has not been through peer review. And I think that the peer review journals can be working in a very synergistic way with the preprint servers. So we can encourage authors, look, you submit to us, you can immediately preprint and have people interacting with you about your science while we're, garnering a bunch of peer reviews and providing feedback in ways that will help you elevate your work and make it suitable for publication in a peer review publication. And in JACC, one of the best venues for peer review publication, or in other places if it's not suitable for JACC. But I think it's very important that we recognize that there's a need for people when they finish their work and they're now undergoing peer review to be able to get the feedback. And then, I work a lot in data science and AI these days. And if I just depended on what was peer reviewed, I'd be far behind. I need to know what's coming out, what's at the forefront, even if it's not fully formed. But the peer review is the article of record. That's been through peer review, and that doesn't mean it's perfect, but it means it's at least been vetted, and people can put more credence in that kind of work as it's been through that process. So they form, I think, two different functions. One is to get out preliminary work, not peer reviewed, sort of cutting edge maybe because it's recent but not fully formed, versus an article of record that has been through the peer review process, vetted, and it sort of has different dimensions to it. And if you've got both, you can see, what did this look like before and after? We in the peer review business now can be accountable for how we actually helped authors to elevate their work, and is this now better than what it was when it was first posted? But I believe both can exist, and we ought to be working together to ensure that they complement each other, that they're part of this research ecosystem.
That was the word, complement rather than compete. I do think they are complementary rather than competitive. And I do think one of the most important examples of the value was back in the pandemic, when the authors pre-printed the data about airborne transmission of COVID from those people, those original cohort of Americans. And they showed that, the COVID was in the ventilation systems, that it was out around all the nursing stations, that it wasn't contained in the room, and that most likely the transmission was airborne. And that was really caused the scientists within the government to advocate for things like mask wearing. So I do think there is a lot of information that can be very important to public health that really should see the light of day before it's fully vetted, as you're saying.
Well, and I mean, ideally in the preprint server, there's lots of people weighing in when it's consequential. So when the Recover trial group, came out with dexamethasone, a lot of people weighed in, and then it was submitted in New England Journal and published not that long afterwards. But it allowed us, while it was going through peer review, for everyone to participate in public comment and, in essence, augment the peer review of this piece. And I've had that experience. I've pre-printed things. I got good comments from the journal, but I'd also gotten good comments through the public comment. And then ultimately, the final product was a result of both what the journal had helped me to do and what I'd heard from a wide range of other reviewers who were giving me comments on my work. And so I think it's okay. They can both exist. When it comes up on the preprint server, there should be a higher degree of skepticism. I mean, to know, this has not yet been vetted. If you're an expert in the field like you are, Mike, and you're reading things on the preprint server, I mean, you can evaluate, their strengths and weaknesses because you have those skills. But for people who aren't researchers, they need to know that, this is still going through the process, and experts need to really weigh in before they can know whether or not this is something they can rely on.
I agree. Well, JACC has, as you laid out, such a great history. I know that you're going to just add to that and exceed it, Harlan. We're all lucky to have you in this position, and we all look forward to working with you. Congratulations.
Yeah, thanks, Mike. You're so kind, and I'm so lucky to have you and as a friend and colleague, and really appreciate your comments.
Great. Well, thanks, Harlan. Thanks for joining us, and thanks to all of you for joining us here for this update on the vision for JACC.